the behavior affecting the neurochemistry in the brain. It's not really a hard concept to understand. We all sort of understand the concept of a runner's high, right? People go running, and that behavior causes a change in the endorphins in the brain. And we know that certain behaviors, whether it's binging from food or compulsive gambling, can cause changes in neurochemistry. Okay? We also have come to learn talk more about other addictions, and I'd like to always say something about nicotine dependency, and because it's, in my mind, sort of like a stepchild of addiction medicine. And slide is from Everett Koop, who was the Surgeon General in 1989. He said that we were losing about 3 jumbo jets worth of people every day to tobacco dependency. That was in 1989. Now, I'd like to think that we've made some progress since 1989, and I would suggest that nowadays we're probably only losing 2 jumbo jets worth of people every day from nicotine dependency. There are still more morbidity and mortality from tobacco dependency today than there is alcohol and drugs, motor vehicle accidents combined. So it's still a very big problem. So I'm trying to convince you, I guess, that alcohol and drugs is a disease. Okay? So I'm going to try and explain that. So I'm going to try and suggest it's a chronic medical biopsychosocial disease. Okay? So for an example, I would suggest to you that heart disease is also a biopsychosocial disease. So if one develops heart disease, if one has a heart attack, there's a lot of factors that go into determining whether someone has a heart attack, right? It's not just whether your father had heart disease, it's what your lifestyle is. Do you have diabetes? Do you take your diabetic medicine? Do you follow your diet? Do you exercise? You know, do you have a sedentary lifestyle? There's a lot of different factors. You have hypertension. Do you take your hypertension medicine? A lot of factors go into determining whether you develop heart disease. Likewise, with addictions, there's a lot of factors that go into it. I want to digress. I should have said this earlier. You might hear this evening I'm using the words alcohol and drugs interchangeably, and that's because we've come to understand that alcohol is a drug, and they really are the same thing. If you think about it, what is alcohol? Well, alcohol is something that people mix. It's a socially acceptable liquid form of a drug, and we mix it with Coca-Cola or 7-Up or whatever, tonic water, and you drink it. And it gets into your stomach, and it gets absorbed into your bloodstream, and it gets up to your brain. And your brain doesn't really care whether it's socially acceptable or isn't, or how it came in. It doesn't care if you snorted it through your nose, or you shot it through your vein, or you huffed it through your lungs. The only thing your brain knows is that there's a chemical up there floating around affecting the way it functions. So in our minds, alcohol is a drug. So tonight you'll hear me using the words interchangeably. So I'm suggesting it's a multifactorial disease, a chronic medical illness. I want to compare briefly alcohol and drug addiction to other chronic medical problems. Okay, so how does it compare to asthma, diabetes, and hypertension? Well, we're going to compare briefly heritability estimates, compliance issues, and relapse rates, and see how alcohol and drugs compare to these chronic illnesses. But this is a busy slide, but the main thing is, what is an heritability estimate? An heritability estimate is what percentage of the risk of developing that disease is genetically determined. Let me say that again. What percentage of your risk of developing that disease is genetically determined? So if you look, for example, at asthma, if you average this out, 0.3, about 0.5, about 50% of your risk of developing adult asthma is genetically determined. Okay? The other 50% is environmental and other factors. Type 1 diabetes is, we know, very inheritable, and about 85% of your risk of developing type 1 diabetes is genetically determined. And so on down the line. Now, if you look at hypertension, it looks like it's about 37% or thereabouts risk of developing is genetically determined. Here's alcohol and drugs down here. About 55% of your risk of developing an addiction is genetically determined. Another busy slide, this is about compliance rates. And just for purposes of time, we don't really need to go through all this except for to say, if you look here, we're not very good. Us Americans, we're not very compliant with our diabetic treatment, our diet. We have a lot of relapses in our hypertension. We're not very good with our asthma medicines. We're not very compliant with our diets. And our compliance, we're not very compliant with our treatments. Similarly with alcohol and drugs. And this slide shows relapse rates. And if you look at relapse rates, drug addiction, not really dissimilar from asthma or diabetes or hypertension. So I'm suggesting, again, that alcohol and drug addiction, like other chronic medical illnesses. So I guess I want to talk a little bit about what we know about who develops addiction and how and what are the factors. Well, I've mentioned already there's genetic factors, so we're going to talk a little bit about some of the genetic factors. So we know, for example, that if you go to a place like Peachford Hospital or Ridgeview, and you look at the alcoholics there, you'll find that about 48% of them have an alcoholic mother or father. That's a pretty high percentage. If you go over here to Perimeter Mall and you gather up 100 people, it's not 48%. It's more like about 10% that have an alcoholic parent. So that right there shows that there's a familial component to it. When I was in my training at the VA hospital, I knew that there was genetic differences between patients. I would have one patient in the bed lay next to another. They'd be about the same body weight. They have a similar drinking history, one would say. They drink about the same amount. And one was there at 35 years of age, dying from cirrhosis in the liver. And the other one was 60 years old with a little liver inflammation, still sort of cruising along. And that's because genetic differences in how people metabolize and deal with liquor, and also genetic factors. They also in the 80s did some studies in the Scandinavian countries, twinning studies and adoption studies. And the best way to describe this is, let's assume that Janice and Ann in the front row here, let's assume they're identical twins. And they were raised in one of the Scandinavian countries, and they were participated in this study. What happens is they pick the Scandinavian countries because they're smaller countries, more closed society. They were better able to keep medical records and all that. So what they did is they looked at twins, identical twins, who were raised in separate parts of the country, were separated at birth and raised in separate parts of the country. Not because of the study, obviously, but for other reasons. And they followed them over like 25 years. And what did they find? If one twin was an alcoholic, what was the chances that the identical twin raised in a different part of the country was an alcoholic? Any guesses?
85%?
It was actually about 60%.
Okay.
About 60%. Now, the other part of that study is they also looked at siblings or fraternal twins. So siblings and fraternal twins, they share 25% of the same genetic material, not 100%. So if they followed them and one was alcoholic, what was the chances that a sibling or a fraternal twin raised in a different family in a different part of the country, if one was alcoholic, what were the chances that the other one was?
15%.
About 25%, 20-25%. So it's really that difference between the 60% and the 20% is what really proves the genetic basis of alcoholism. It's called concordance rates. So those are some of the studies they've done to sort of prove the genetic basis of addiction. What other factors go into determining whether someone develops an addiction or alcoholism? As I mentioned, I'm saying that about 55% of the risk of developing it is genetic. What are some of the other factors? What about the other 45%? Well, we know that childhood trauma is a factor who develops addiction. We've known for a long time that someone who loses a parent at a young age is at higher risk for developing an addiction. I like to break out traumas into what I call intentional and unintentional.